Most of us don't pay much attention to the appearance of our urine when we go to the bathroom and tend to underestimate it, but we know that it can give us valuable information about our health status and signal us when something in our body is not working properly. One of the most common variations is the presence of foam in the urine, and it can be due to a series of causes, more or less serious. But what are they? Let's go see them. Urine is the waste product formed through the filtration of blood by the kidneys, which act as natural filters to remove useless or harmful substances from our body. In a healthy adult, urine appears as a clear straw-yellow liquid with no unpleasant odors. However, in some cases, urine may appear foamy, characterized by the presence of persistent bubbles on the surface. This phenomenon is due to the trapping of air in the urine and the surfactants present in it, such as proteins and bile salts. Among the less worrying causes, we find a poor hydration of the organism, which increases the concentration of substances present in the urine, or a strong urinary stream due to excessive pressure at the moment of exit from the urethra. However, an abnormal and persistent amount of foam in the urine may indicate the presence of proteins in it, usually albumin. This is the most abundant protein in the plasma. It is synthesized by the liver and plays an important role in maintaining the balance of body fluids and in the transport of many hormones, drugs, and free fatty acids. This medical condition is known as proteinuria and may be due to poor hydration of the body, which can be resolved simply by increasing the daily intake of water. It can also occur temporarily after intense physical activity, following a period of great stress, or after taking certain medications, including antihypertensives. In other cases, however, proteinuria, and therefore the presence of foam in the urine, may be due to some pathologies, especially those affecting the kidneys and bile ducts. One of these is glomerulonephritis, an inflammatory pathology of the kidneys, which, as the name suggests, affects the renal glomeruli. These are filter structures composed of a dense network of arterial capillaries, which have the task of filtering the blood, removing waste substances, and forming urine. If the glomeruli do not function correctly, however, their filtering capacity is compromised, allowing the passage of proteins and other substances into the urine, which will thus take on a foamy appearance. Another possible cause is diabetic nephropathy, a disease that slowly but progressively damages the kidney function of some diabetic patients. The excessive filtration of glucose and proteins in the glomeruli causes an overload of work for these structures and determines irreversible kidney damage. In fact, diabetic nephropathy is the main cause of chronic kidney failure and at the same time an important cardiovascular risk factor in diabetics. Foamy urine can also occur due to kidney or urinary tract infections, chronic liver disease, bile duct obstruction, or a vesico-intestinal fistula. In the latter case, an abnormal communication is created between the bladder and an intestinal tract, which causes gas, or fecal matter, to pass into the urinary tract, leading to a series of consequences, including the presence of foam in the urine. In conclusion, in most cases, foamy urine is not a cause for concern. However, if it persists or occurs along with other symptoms, it is important to contact your doctor or a specialist. A simple urine test can identify any abnormalities, such as the presence of proteins or other substances.